one of the other common hemoglobinopathies, right? I mean, we can get into there's the thalassemias,
Yeah.
and then there's sickle cell
Sickle cell
anemia.
anemia.
Why don't we talk about that and get into that a little
Sure,
bit?
sure, sure.
Yeah.
So sickle cell anemia it's more common in certain genetic predispositions, and so African American patients are more predisposed because it's a more of a genetic related disease. There's sickle cell disease and sickle cell trait, and so basically, where sickle cell disease, you actually have mutation in both of the genes, and so it's a glutamic acid, I believe, to valine, and that's why there's a mutation, and so the hemoglobin comes out sort of mutated, and so they don't last as long, and so under lower oxygen content, they undergo more stress. And so you can get a sickling formation on the actual slide where you look at the red blood cells, and that can cause issues with symptoms. And so patients complain about pain crisis. It's because they're either their body's under stress, and so there's a lot more sickling of the hemoglobin that you normally do see. And so, like, pain crisis is one of them that patients can have. Acute chest syndrome is one of them. I'm sure as an ICU doc, you see a fair share of acute chest syndrome. And so, and usually it's more because the hemoglobin is under stress, and so it sort of sickles and it can cause vaso-occlusion and blood vessels. And so,
Yes. So like with sickle cell disease, again, Black people have sickle cell disease. The reason why we have sickle cell disease is because when you look at Africa, actually, there's a disease in Africa that's prominent called malaria. Turns out that when you have sickle cell trait, right, not sickle cell disease, right, but sickle cell trait, when some of your red blood cells look a little bit different, malaria can't infect it as well. It can't polymerize within that red blood cell. So in other words, you won't die from this life-threatening infection in Africa. So a lot of people evolved to have sickle cell trait. That's really where it actually stems from. When you look at sickle cell trait, as a result of the hemoglobin molecule looking a little bit different on that erythrocyte, it changes the shape of the red blood cell. So now these red blood cells, which are sickled, can clump together and they can lyse. And when they lyse, it creates an inflammatory response. They clump together and they cause little vaso-occlusions. So they actually block the arteries that the blood is trying to travel through. When you block the arteries the blood is trying to travel through, what happens? You get infarctions, right? So some tissue dies. Sometimes you can get bone infarctions. You can get pulmonary infarctions.
Yeah, and then spleen infarctions.
Spleen infarctions. When you get spleen infarctions, that organ can die off. The spleen's important, right? It really helps us out immunologically, and it helps us out from a blood cleaning standpoint. So you get all these pipes that get clogged up. And when these pipes get clogged up, it can lead to pain, right? And when you have pain and you have pipes that are clogged up, so you don't have a lot of blood vessels that are working within the lung, and some of the lung dies off and you get an overabundance of bacteria, you get infected. When you have a new radiograph infiltrate, when you have a fever and you have chest pain, we call it acute chest syndrome, right? And so that's what actually happens in these sickle cell patients. Now, the most, like, and I'm just going to be blunt, the thing about sickle cell disease, the thing about sickle cell trait is it is one of, if not the most, underfunded disease in terms of research. And there's been lots of discussion on why. Is it because it only affects people that look like me, right? Is that why it's underfunded, right? A lot of people feel that way. But when you look at the development of therapies, it's got like the least amount of developed therapies because it doesn't affect the majority, which is in this country. That's probably why it's understudied. I hate to get political and have conspiracy, but it's actually true. And so it's a really big problem in medical society because honestly, it's really just a small, in sickle cell trait, it's just an amino acid difference, like you said. So genes, basically what happens with your chromosomes, right? So your chromosomes make up your body. Your chromosomes are full of genes. Genes get transcripted and translated to proteins, right? So DNA becomes RNA. RNA gets spliced, and then it goes through a ribosome, and then you start to make proteins. So you got different amino acids stacked on top of one another. It's how your body works. That's what it does. And so what we're talking about for sickle cell is one of those amino acids has changed. Like, that's it. There's another disease that's actually probably, and I think it's less common than sickle cell, but it just affects people that are the majority, cystic fibrosis, and you got tons of therapies for that, right? You've got tons of therapies being developed. It's funded, it's being researched and all of that. So hopefully sickle cell disease will get there.